And resilience is really like knowing that you can handle anything that comes. It's really that inner knowing confidence to know, hey, I got through this. And you shift things because we all have suffering. We all have, I'm not unique. We all have either health crisis, financial crisis, divorce, death. It's inevitable if we're living in this life. And so for me, it's like having this perspective on what is this doing for me instead of to me, and partnering with those difficult situations to actually get the pearls of great price, as we sometimes call them, from the experience, because always the experience is there to teach our soul something new.
Somebody get this guy some help!
Or, put more simply,
If you need help like this guy, call your own doctor.
So today on Renegade Psych, we have Dr. Jill Carnahan, an MD and a prominent functional medicine expert dedicated to identifying and treating the root causes of illnesses through personalized care. She earned her Bachelor of Science in Bioengineering from the University of Illinois at Champaign-Urbana in 1998 and graduated with honors from Loyola University Stritch School of Medicine in 2003. Completed your residency in family medicine at the University of Illinois in 2006, and then in 2009 founded the Methodist Center for Integrative Medicine in Peoria, Illinois, serving as the medical director. Following that, you relocated, I believe, to Boulder, Colorado, and established Flatiron Functional Medicine in Louisville, I assume is how you pronounce it. Offering a comprehensive range of services, including nutritional consults, chiropractic therapy, naturopathic medicine, acupuncture, and massage therapy. And very importantly and relevant to your personal life, you are a survivor of both breast cancer and Crohn's disease, experiences that I understand fueled a passion for teaching patients how to thrive amid complex and chronic illness. You're a very sought after inspirational speaker and work to educate physicians worldwide on personalized and functional medicine principles with work that's been featured in publications such as Shape Magazine, Parade, Forbes, and the Huffington Post. And I think you were also on some NBC News health segments with Joan London. Authored multiple books, including Personalized and Precision Integrative Cardiovascular Medicine. And also, I think a couple of years ago, released a prescriptive memoir. So thank you for coming on the podcast and welcome to Renegade Site.
Thank you, Dr. Short. I'm excited to be here.
How are you doing today and what has your day looked like?
Doing well. Today, interestingly, I get IVIG infusions because my immune system since cancer hasn't been normal. So today, this morning was an infusion. I take a short nap afterwards and then I'm ready to go. So that was today. It's a Tuesday out of clinic.
I've always been curious, how does it feel to get infusion of IVIG? And if you could give a little bit of background for non-medicine folks, what is
Sure.
IVIG?
Yeah, so and it's funny because I don't talk a ton about this part of my health, but after the cancer, now I wonder in hindsight, because immune deficiency can actually lead to cancer. So it could have been that I was born with some sort of an immune deficiency and never knew it until like a decade ago when I started getting infusions. Or it could have been that the chemotherapy, I had 3 drug, very aggressive chemo for breast cancer at 25 years old, that could have affected my immune system. And so what happened is in 2015, shortly after I got diagnosed with mold-related illness, I was diagnosed with common variable immune deficiency, which means I don't produce as many immunoglobulins, which are like these little antibodies that grab onto viruses and bacteria. So that level was low enough that I started getting infusions of a plasma product, which is like thousands of donors' plasma that's just their own immunoglobulins. So I get an infusion. It's called IVIG or IV immunoglobulin therapy. It actually is really, really good for also patients with autoimmune disease, neurological disease, and of course, immune deficiency. And I've now, it's been about a decade on the IVIG, and it just sustains me, keeps me doing well. I'm on a much lower dose than I used to be on. And it's interesting, in the beginning, you often do have a flu-like 24-hour period or exhaustion or feeling. And when I first started, it was like that. And like I said, now it's maybe 30 minutes of a little fatigue, and then I feel great.
Imagine, because you're introducing a substance that your
Right,
body recognizes as foreign, right?
right.
But
Yeah,
over time probably gets more used to interacting with
yeah.
those molecules, and so doesn't mount the same immune response.
Yeah, exactly. Yeah, the first few were brutal. That was years and years and years ago. And even now, patients that I have start on that, you have to go very slow and very methodical. And it takes a few months to get to where you can get used to that. And it's all about rate and volume because you're really just changing, your plasma is actually getting a volume with a protein in it. And so there's fluxes of different fluids in your system and all of that.
Hopefully, it is helpful in the next month or so for your immune system and fighting off infections. So, I stumbled across your work actually because I'm a huge proponent of lithium and the
Yeah.
use of lithium in psychiatric disorders, not just in what we call bipolar disorder, but various others. In seeing your literature online about lithium, I then stumbled across your story, and you have a really incredible story. I'll give the bare bones. I think when you were in medical school or residency, you had a breast lump, and I would have had the same kind of thought. Of course, if I was female and had a breast lump,
Yeah.
like, oh, it's probably nothing. But I think it was your husband or boyfriend that was like, no, you should get it checked out. Tell us about your experience and how that kind of shaped your professional life and the path that you're on today.
Yeah, so in the backstory is I grew up on a farm in central Illinois, one of five children. My mother was a nurse who retired to raise us all, and really kind of an idyllic Norman Rockwell-esque life, like a really good life, a really good childhood. Unbeknownst to me, though, I think some of the chemicals on the farm, the pesticides, the herbicides, all the things that we were exposed to and probably were in our well water, were silently actually doing damage to my system. And there was probably some genetics involved and other things that wasn't just the chemicals, but I do believe that farm environment with that chemical exposure had an effect for me getting a cancer that was aggressive at 25 years old. And more proof to that, my sister, who was 7 years younger than me, got thyroid cancer at 28. So we both in our 20s had endocrine cancers, which endocrine organs are those kind of sentinel organs that get a lot of effect from our environmental toxic load. So in that journey, I became an environmental toxicity expert, partially because of my history. And what happened is I'm in medical school training to become a doctor. And all of a sudden, during my surgical rotation, I find a lump in my left breast. Like you said, I was like, I don't have time for this. I'm 25. It's not cancer. I was married at the time, and my husband was like, you must get it checked out. And I was like, "Ugh, I don't have time. Ended up getting it checked out, getting a biopsy. And I'll never forget the day I get the call from the surgeon who's like, Jill, I don't even know how to tell you this. You have aggressive breast cancer. The grade of the cells are like we've never seen before. You're going to need full-fledged treatment, and that you're in the battle of your life. And anyone who's dealt with life-threatening illness can understand this, but it just like that one phone call changes your life. And now I look back 20 years later and I am healthy and well and no traces of the cancer. But at that moment, you don't know if you have 6 months or 6 years or what's going on. So I ended up doing very aggressive three-drug chemo. Some of the doses, like doxorubicin, which is cardiotoxic, were calculated to figure out how much lifetime could I tolerate of that drug before my heart would fail. And that's the dose I got. So like I can never ever get that drug again. I've had my lifetime capacity. And then three drugs like that. That's why I wonder, did that affect my immune system? Because all of these drugs work on rapidly dividing cells, which our immune system's part of, our gut's part of. And so I was really, really sick from the chemo, but I got through all of that treatment and ended up going into remission, doing great, went back to med school and was bald and exhausted and sick from chemo, but I was back in med school. And only a short 6 months later, I ended up passing out in my ER rotation, was rushed into surgery for an emergency abscess they found, and I was diagnosed with Crohn's disease. And it's in hindsight, it kind of makes sense because I had a predisposition. There's a genetic called NOD2, which means you have an abnormally aggressive response to a normal microbiome. You're more prone to Crohn's, which is an autoimmune attack of your gut lining. And for me, the chemo was the thing that tipped me over into that. And also unknowingly, I was celiac and had been eating gluten for my whole life up until 26 years old. So all those things kind of led to this leaky gut, this stimulation of microbiome that caused an aggressive reaction that led to Crohn's. But I think it was also part of the cancer and the treatment that allowed that to manifest.
That's an incredibly powerful story. I can imagine that it must have scared the absolute shit out of you to receive that phone call. On the flip side, though, I would bet that at the end of that 6 months, once you felt more comfortable with your Crohn's diagnosis, that maybe there was a little bit of like, well, what can stop me now?
You're right. Over the years, I mean, it took a while to get to that, but I
Yeah.
definitely, especially now, I feel like when I talk about resilience and training people for resilience, and I wrote a book about resilience, and resilience is really like knowing that you can handle anything that comes. It's really that inner knowing confidence to know, hey, I got through this. And you shift things because we all have suffering. We all have, I'm not unique. We all have either health crisis, financial crisis, divorce, death. It's inevitable if we're living in this life. And so for me, it's like having this perspective on what is this doing for me instead of to me, and partnering with those difficult situations to actually get the pearls of great price, as we sometimes call them, from the experience, because always the experience is there to teach our soul something new. And I look back now and I would have never, ever, ever become the doctor that I am today without really going through as a patient and understanding how does it feel to be a patient? How does it feel to face your own mortality? How does it feel to have to figure out how to heal your gut when your doctor says diet has nothing to do with it? These kinds of things were lessons that I learned that were far more powerful than any medical training.
Do you think that you would have entered into the functional space or that you would be practicing the way that you practice now had you not had that experience?
So interestingly enough, I did grow up with a very holistic perspective. We saw like chiropractors sometimes as a child, and then my mom would do teas and herbal remedies. We still went to the doctor. It wasn't like we weren't medical, but it was like there was some more like the earth brings food and good food helps our health and clean air and clean water. Those were kind of parts of how we grew up. So I actually kind of reluctantly went into allopathic medicine because I thought, oh, maybe some of these other alternative acupuncture, massage therapy, physical therapy, chiropractic might be better aligned. But what I realized is as I was applying to all these different schools, I actually applied to all of these different traditions. And I was like, well, why don't I apply to MD school? What if I actually went there, learned the best reimbursable system in the US at the moment? You know, it doesn't mean it's the best, it just means right now it's the primary system for reimbursement. And what if I actually got the best information so that I really knew how to be in that system and the good things that come from it, but also brought a new perspective. So I kind of feel like from the beginning, I had this idea of getting the best of what the Western medicine has to offer, but also having like keeping my own holistic perspective. But it really amplified it going through that because then I had to decide the rubber meets the road. It's your body, right? What are you going to do? And it was kind of tough because it was so aggressive and I was 25. I ended up doing very aggressive conventional therapy. But I also did supplements, nutrition, prayer, meditation, like everything you could imagine on the other side. And I feel like the reason I'm thriving today is the combination. I probably was saved by some of the conventional, but even today with my immune system, I think I have to live forever with the sequelae of some of those toxic drugs.
Yeah, absolutely. Your background training wise is really fascinating in the fact that you have an MD and you went through that really extensive, at a minimum, 12-year or 11-year process of training, but then you also have this holistic background. So you know the reality of being in medical school and residency, and many doctors dismiss functional medicine as unscientific or pseudoscience. And as medical students, I know I didn't get a whole lot of training, really, if any. How do you respond to that criticism? And how do you think that medical schools are failing their trainees in today's system?
Yeah, so I've said this before, but the first important thing is to frame that there are great things for Western medicine. So if you have a car accident, you have a stroke, you have a heart attack, you break your leg, any sort of trauma, any sort of acute crisis, the best thing in the world is a conventional system. In fact, you probably don't want to be in a foreign third world country where they don't have like something to create lack of blood clot for a heart attack, whatever it is. So it's really good for those things. And we're still the leading in the world for most of those kind of crisis situations. However, what's happened is this epidemic of chronic illness, whether it be obesity, diabetes, heart disease, lifestyle related things, or it becomes autoimmunity, inflammation, gut dysbiosis, leaky gut, Alzheimer's, neurological disorders, all of these kinds of things that we're seeing, cancer, autoimmune disease, neurological, neurodegenerative disorders, and then also metabolic disorders. All of those are not cured by a drug or a procedure. They might be symptomatically helped, or maybe your A1C is kept down by a med, but it never reverses the process. The way to reverse those processes is number one, root cause. What led to this in the first place, which is the definition of functional medicine. And then also for metabolic disorders, it's lifestyle, it's movement, it's aerobic exercise, it's strength training, it's the diet that we eat, the air that we breathe, the food that we consume, the sleep that we get, and then sometimes the biohacking things like red light or PEMF. But those are the things that are actually going to make a change in that trajectory. I always say it's not like Tuesday you're normal and then Wednesday you're diabetic. There's no doorway you walk through. You're always walking along a trajectory, either towards disease or away from disease. And the beauty of functional integrative medicine is we take the best of conventional. We still use meds. I still prescribe. I use all kinds of tools in that toolbox when needed. But my toolbox is much, much bigger. And I can actually say, where did this start? What's the root cause? And in a functional perspective, it's often toxic load or infectious burden, creating immune dysfunction and inflammation at the core. And even with mental illness, as you know, so often we separate the mind from the body, but most often depression, anxiety, bipolar, even schizophrenia are often organically caused in nature. And if we can find some of those predisposing factors or triggers, we can actually often treat or reverse them with or without medication.
You mean to tell me that depression isn't right here and anxiety's not right here? That my whole brain is connected and it's one functioning organ that has billions of different connections and they're all probably relevant and important to how we anyway.
Amazing, isn't it? I know, amazing.
It I thought it was interesting. You felt like maybe some of those, what you called silent chemicals on the farm, contributed to your cancer or to your immune dysfunction. And that speaks to something I know that you're really passionate about is how we're good at treating things acutely, but for other things like silent exposure to chemicals, if that was a, relevant factor to your diagnosis, that happened over a long period of time. So it doesn't make common sense for us to think that we can treat something like that or like diabetes in a flash, even if we can get a number on a lab to drop. Talk a little bit more about that, or kind of drive, or I don't know if it's an academic drive or if it's more of a pharmaceutical drive to try to treat everything so fast and bypass treatments that maybe like the IVIG that if you tolerate it, you don't experience the side effect, you don't feel anything from it. Your mind doesn't connect, oh, I got IVIG, I'm at a less of a risk of different infections, but we know by the data that that is the case. Can you speak on that a little bit more in depth?
Yes, I love talking about this because one of the things that's most difficult, especially with cancer research, latency matters, which means like for me, and let's think about this. So what we know to be true is all the time right now, you and I sitting here, we have cells that are going rogue, that are starting to divide rapidly, do wrong things. Maybe there's a DNA mutation and so they're replicating at an abnormally fast rate or making weird cells. And our body, if our immune system is healthy and robust, it's like sees those, it targets and causes autophagy, which is programmed cell death. And so that those never become cancer cells. Like our immune system is made to detect these cancer cells and then just eliminate them. And we never develop a cancer. So why would we get cancer, right? If that's working. What happens is there's either more aggressive form of cells that is not able to be controlled by the immune system, or the mass of them becomes so big that it overwhelms the immune system, or like in my case, there might have been chemicals or things that were actually suppressing my immune system. Or maybe I had an immune deficiency before I ever knew about the cancer. Maybe I was born with that. Who knows? But all of those things have come to play. And that's to say, at 25, I find out I have a tumor, about 2 centimeter tumor in my breast. Well, it took 5, 10, maybe even more years from when that first cell went rogue, which means if I'm 25, that's like 15 or 10 or even younger. And interestingly enough, this is something I haven't talked a lot about either, but so profound. I went back, talked to my mom, looked at photos and stuff. When I was about 5 years old, I had this episode of precocious puberty. What does that mean? That means I'm a 5 year old. I had breast bud development, a child, right? A little girl. And my mom took me to the pediatrician and said, huh, this doesn't look right on my little girl. What's going on? And he's like, oh, it's no big deal. It'll go away. So my mom ignored it. It did go away. But don't you and I know when we think about this, or if you're listening, what happened was there was something, it might have been an environmental chemical that was estrogen-like. We call these endocrine disruptors. A lot of the pesticides like atrazine act like estrogens on the body. And whether it was in my well water that I was drinking, or maybe the food that I was eating, or maybe from my mom's umbilical cord to my placenta in utero, I got some signal to my breast tissue at 5 years old that it's supposed to divide and grow. And for some reason, that pediatrician didn't know any better and said, ignore it. But there's no doubt in my mind that had something to do with me 20 years later getting breast cancer. Doesn't it make sense, right? And so we think about this and we think about, and because of that, that's 20 years lag time. And that's so important to understand because 70% of breast cancers can be contributed to chemical carcinogens or modifiable risk factors. People don't know this. And the number one question I get was like, oh, 25, do you have a genetic risk? Was there, some genetics? And the answer is no. And for 80 to 90% of young women with breast cancer, there's no genetic risk. It's an environmental factor. And this is so interesting to think about because back to your question was, how do we know? So if we think about environmental chemicals, it's very hard to pinpoint something 20 years ago that triggered it. And then that whole 20 years, there's probably multiple factors, right? And what if I had mast cell issues, allergies, asthma? Mast cells have now been associated with increased risk of cancer. So what if this whole mast cell activation syndrome that I probably had from my youth and never knew about that was also contributing to a weakened immune system? What if the toxic chemicals? What if in utero mother's blood supply, maybe mother's toxic load? And I could name 100 other things, but there's so many factors that contribute to a diagnosis. And if we start to look back, we start to make the map and create a story that's cohesive so that we can actually prevent or reverse disease in the future.
I love the nuance that you provide there in how you embrace the uncertainty about what it was that caused it, or, the reality that you probably will never have total certainty about the root cause of that. How do you take that same approach into any given patient that you see? You're working initially to find a reversible or a root cause, but sometimes it's just not that easy, and we just don't have the ways of measuring things to decipher what the actual root cause is. How do you take your approach into the patient encounter?
What a great question, because the truth is, I always frame it as toxic load plus infectious burden, as I mentioned, kind of go in to create immune dysfunction of any type or chronic complex illness for most of my patients. And when I teach about environmental toxic load, I talk about the bucket idea. Many people have talked about this, including Sid Baker long ago. And what it is we all have this bucket capacity when we're born. Some of us have a very small bucket, some people very large bucket. And that is our ability to withstand insult, whether it's viruses or bacteria or toxic chemicals or air that we breathe that's chemical or mold or metals. And all these things start to load up over our life. And what happens is when they start to reach the edge of our bucket and spill over, the most common three things we see is cancer, autoimmunity, and neurodegenerative diseases. So these are all three epidemic in the existence and the amount that we're diagnosing. And so when we reach that limit, it starts to spill over the top. So say someone comes into me with new onset dementia or cancer or Hashimoto's thyroiditis. What I'm thinking is, okay, their toxic load is going over the bucket. So I'm going to do the best that I can to test and see some of the toxicity. And we now have urine panels and panels for some chemicals, but there is no way, even today, to test a full toxic load for any patient. It's just impossible. We don't have the ability. We can have a little snapshot, but the beautiful thing is if you know they're toxically overloaded, you can take those same principles of detox. And we know that we detox when the blood flows through the kidneys and the liver. So our bowels and our urine, our sweat, our lungs as we breathe out, or through our skin as we sweat. So what you can do is take the principles of detoxification and apply it to a situation, even if we don't know all the different things in the bucket. And as I mentioned, sometimes when I'm teaching physicians, their eyes get glazed over and they're overwhelmed. They're like, oh my gosh, toxicity's everywhere. What are we going to do? It's so depressing. How do we assess our patients? Well, you know what? The truth is you don't have to know every last thing in that bucket. All you have to do as a physician or a patient is create margin. And how do we do margin? Oh, well, let's start moving. Let's start sweating. Let's start eating clean. And I always say, let's start with clean air, clean water, clean food, put the inputs, make them clean so that you're not creating more load. So you can start with very basic things, even if you don't know what's in the bucket.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.
Or, put more simply,
If you need help like this guy, call your own doctor.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor, and like, comment, subscribe. Do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.